Now we have the patient here. So you see that they have been making some soft tissue over that. This is the surgical guide, and the surgical guide is snapped over the teeth, okay? So with this surgical guide, which is snap over, and every time when you receive such a guide, you try it before starting the surgery, okay? In this case, I have been making some round curves here, you know, to make it more easy to place in the patient's mouth. And you put it inside like this. So here, yes, you see the tray, which is the surgical tray of easy implant. And what is new is this. These are the Trifine. So we are going to use Trifine to remove the soft tissue and to go inside the first entry inside the bone. So I go here like this. I go inside the bone and I remove. To clean it, this is a new design of a Trifine. You just unscrew and you can remove the excess of tissue. Okay? The gauge of the drill has been increased so that you can remove more tissue without heating. Okay? So I remove that and I'm going to do the second one. And we do the second one like this. We are guided. There is no metal. We are just guided inside the tissue. So we remove that. We clean it again. Okay? And then I go to the front one. The front one was designed for a bigger implant, so it's a bigger screw, but I don't have the new cylinders right now because it's brand new, and I use the old one to do the same. I go inside and I remove the whole thing. Okay? So when this has been used, I can remove that and we have an access to the bone in all that. Do we have some tool to remove like a plier or on a pince or so on? Yes. So we are going to have some plier or something. So this is the first drilling, and I'm going to go to the second one. So no, maybe I'm going to go to the center. I know it's not the same diameter. Good. Let's finish with this. 3.75, 11.5 millimeters. I go down here. I go down like this. Maybe you see better. Okay. It's little hot. Okay, so we've been drilling up to 3.25. So I was wondering if 3.25 was enough for these implants, but maybe the material is softer than the material we had. So we are going to try to place the implants now in these holes. Okay, so these are the holes, and we are going to try to work on these holes. I hope it will fit, but I am not sure. I open that. I change the speed. I go to 25 turns per minute, 45 Newton centimeters. I take the implant and I place the implant in the position of the osteotomy. And now I'm drilling inside and I am placing the implant in the exact right position. Okay? So this implant is a ML. I didn't open for ML, I opened for MS. But it's going to be fine because the top will be inside the soft tissue, I guess. And this is the implant placement which is done. Accuracy less than 1 millimeter. So let's do the other one. I open that, so you see the master implant L, 3.75, 11.5 millimeters. Okay, the lot number and the sterilization number date are placed in the data of my patient, so we can track the patient with all the information we have on that. So that's very important when we do implants. So now I do the second one. I put that in. Okay. I take my implant. No need to screw or unscrew an implant holder. I put that inside the model. And then I go inside and I place my second implant. So the difficult thing has been done with the drilling, which has been guided. And now the placement of the implant is easy because there is one obvious position for that, and that's it. So I go down inside, okay, and that's it. Okay, so you see now you have your two implants which are in the exact right position based on the planning that we did and that you've been able to check before. So let's go back now. I would like to go back to the front one. And the front one is done not with the yellow line, but it's going to be done with the red line. So to do this,
more than 10 millimeters. When you do it at 11
should be in the framework of the dot. Now we are doing down the framework of the bone. That means should be less than
you have drills and a design with
when you do it, but when you